the whole science of photographing large groups was obsolete in Chicago, where I was living. Chicago was a convention city, and there probably were more conventions in Chicago than almost any other city in the country. It was a central location. We would have probably a dozen major conventions a day. And I remember from the time I was 20 to I was 25, I attended 200 probably medical conferences, because as a photographer I was able to get in through the serving door. They never knew who I was. I knew all the back ways. And I used to sit in a conference for 2 or 3 days. And so I got quite a broad background. I attended everything. In fact, one conference I remember was sponsored by the American College of Proctology. And I remember the president of that conference, Dr. Delmer L. Davis of Pasadena, California, who asked me how I enjoyed his meeting at the end of the 3-day session. I told him it was quite interesting, especially some of his operations in hemorrhoids. And he said, "What medical school are you going to?" I said, "I don't go to any school." He says, "Well, why would you be sitting in a lecture like this?" I just told him I have a general interest. So I made a lot of contacts and got a lot of information those days. I got into research and development at that time. Mm-hmm. And the Air Force was one of my customers. They hired me to do a research project on making an optical system for a gun sight called the Norden Bombsight. And it was a basis for bombing precision targets in World War II. And because it had such a high priority, I was entitled to look at any high priority secret material coming in from the Secret Services at that time. I was only interested, however, and not in the technical aspects of making reticles and optical systems, but I was interested in the public health of the countries under the war zone, because I was certain that heart disease was going to double under the stress of the war.
And is that what you found?
No, completely opposite. In my days, that is before World War II, the science thinking of the time was that heredity and stress were the only bases for heart disease. Nothing else made any difference.
And you found that didn't fit with your data?
Completely wrong. It turned out that, I remember in 1944 in England, Wales, for example, heart disease deaths dropped to 50% of pre-war levels. So did diabetic deaths. And when the war was over, it turned out that only those countries with very severe restriction of fat and cholesterol, not caloric restriction, just fat and cholesterol, were the ones that had a drop in heart disease death rates. Those who had no restriction had a rise in heart disease death rates. This was independent of the stress of the war. It had nothing to do with it.
How about after the war? Did they get their problems back?
Oh yes, certainly did. In fact, in Austria in 1958, when there was no stress because everyone had a job, full employment, the reconstruction of the war damage had been finished, the death rate for heart disease was 7 times as high than it was in 1944 when Hitler was walking all over causing great stress.
And then after the war, what got you interested next? I've had a chance to talk to you, and I know you're really fascinated with the literature. How did you get involved in that?
Well, when I saw what happened after the war, and I began to see that it was only the fat and cholesterol that seemed to have made the difference, I then started to investigate countries around the world that were on a very low fat and cholesterol diet. In fact, I looked at the range of the world's population, and I picked out countries on the very lowest fat and cholesterol intake. And I was amazed to find, and there were 25 populations I was able to study, that heart disease practically didn't exist.
There are no heart attacks in the country?
No, unheard of. You couldn't find a case to show to a medical student.
It's amazing.
And not only heart disease, but diabetes, hypertension, breast cancer, colon cancer, prostate cancer, arthritis, glaucoma.
That's all I treat as a doctor.
Where are all these diseases? And these were under hundreds of millions of people. And here I thought these were the natural, inevitable consequence of aging, and that everybody has to die of one of these diseases. And now I find that populations don't die of those. They actually die of old age, which is unheard of in this country. It's true that the unsanitary conditions will promote a high infant mortality rate, But once they're over 40 years old in these countries, they have a much longer lifespan, a life expectancy, than they do in the United States. The United States runs a very per about 15th or 20th in life expectancy after you're 40 years old. In fact, the life expectancy after you're 40 in the United States has only changed by 7 months since 1900. Nothing.
So people like you and I, we're not doing much better, are we?
No. No, in these undeveloped countries, once you get past the unsanitary problems, they live to 100, 105, and so on. But they're healthy up to the last days.
Fully functional.
Right.
I understand you had some personal health problems when you were a young man.
I developed rather serious coronary insufficiency, we know that as heart disease, when I was 40, back in 1955. But I was convinced I had to change my diet before I developed the problem. That is, before it became symptomatic.
But you didn't.
No, I didn't, but I was thinking about it.
Oh,
I remember 2 or 3 years, by the early 50s, I was convinced there was no question about what I had to do. My cholesterol was running at about 300 in those days. But my doctors kept telling me it's in the high normal range, don't worry about it. And I was trying to figure out how to substitute my pint of ice cream every night. And I tried making it out of corn oil, it didn't work at all. And then how to give up my lobster Newburg every Friday night, and my eggs in the morning, and it was a very tough job to try and make substitutes. But when the shock of my diagnosis came, I was very much like a smoker who suddenly discovers he has lung cancer. I was in a state of disbelief. And I probably went to 12 cardiologists to get a second opinion. I won in a row. And they only gave me one opinion, the first opinion. So I was convinced finally, it took me weeks really to believe it. I couldn't believe it because I said, I'm not overweight, I'm relatively active. It couldn't possibly happen to me. After all, I'm only 40 years old, how can I have heart disease? But I had it all right. In fact, it was so bad, if I had a patient now with the kind of test that I developed, I wouldn't let him out of the room. I didn't give up the ice cream immediately. I just gave up everything. I just completely switched my whole diet to that of the undeveloped countries.
They were your model because nobody else was around to tell you what to do.
Worse than that, everyone that was around told me not to do it. They said it didn't make any difference.
And if you did it, were there any risks? Did they tell you?
Oh yes, risk of malnutrition.
I see.
Right. I would fall apart. In fact, when I first started to change my diet, I remember the first I monitored myself for blood tests. My first blood test cost me $200 in those days, and that's when $200 was meant something. I don't know what that means today, maybe $1,000 for tests. I took 180 values. I took every vitamin, every mineral. I took the blood clotting factors, fibrinogen. I was very worried that I was going to go into severe deficiencies to create more problems for myself because of the warnings I got from the dietitians and the physicians and so on.
Do you remember what that diet was exactly that you started eating?
Very simple.
What was it?
It was simply whole grains, beans and peas, fruits and vegetables, potatoes, and I decided at that time to get my cholesterol lowered as fast as possible. I would stop all animal protein and all dairy foods.
You must have felt really alone.
I was alone. In fact, my wife used to tell me that perhaps I don't need a doctor, I need a psychiatrist.
How long did you stay on this type of diet?
I stayed on it. It took me 3 years until my cholesterol dropped to 100.
Oh, I see.
And then I immediately started to eat a certain amount of animal protein and jumped right back to 140 within a month. So I waited another year or two.
Back without the animal protein?
No animal protein. Right. Went back to 100, of course, and stayed there. And I then started to increase my animal protein, or to add animal protein, perhaps 3 or 4 ounces a week. And my cholesterol stayed at 100. And finally, some years later, I tested myself by having 3/4 pound of chicken or fish a day for 6 weeks. My cholesterol was unchanged, 105 to 108. And I realized I'd used up all my excess storage that I had burdened myself with for all these many years. But by that time, I lost my taste for animal protein.
So why did you add it back? Did you think that maybe you had a plan for other people that maybe didn't want to give up?
No, I couldn't figure out how to get my vitamin B12.
I see.
And so I calculated the minimum I would need to get my vitamin B12, about a microgram a day, and that's about what I fixed on. I started then to exercise. Incidentally, my cardiologist told me that I must limit all my activity to 4 blocks of walking a day. That's for the whole day. If you got 4 trips, a block a trip is my limit. A nap every day after lunch. Medication of various kinds to help my condition. Incidentally, when I went on medication, I got much worse. And when I complained to the cardiologist that I was getting worse with the medication, he says, "Don't worry, we have a lot of medications to try." That was my last medication. In 1966, I took a definitive test for my heart disease problem. By this time, ignoring the advice of my cardiologist and so on, once my cholesterol dropped down to 100, I felt I was safe to start increasing my exercise. And I gradually did, over a period of 6 or 8 years, I can't remember now, until I was running about 7 or 8 miles at a run. And I had a stress treadmill test, where I ran on the treadmill at 8.5 miles an hour for 20 minutes. So I ran 3 miles on the treadmill, and I had it continuously taped. So I recorded every heartbeat. And I didn't have one heartbeat that showed insufficient amount of blood at my peak. I got up to 177 beats a minute, I remember. It took me about 8 minutes to get up to the speed. But not one abnormal beat for 20 minutes. And that was the end, and I knew I was cured. And I'm very fortunate in those days they didn't have bypass surgery. They didn't have angiograms, or else I'd been on the table with bypass surgery, because I always had the best medical care. In 1966, I became so enthusiastic that I decided to change the whole world of sick people. And I remember I went to a party. I saw a man who bent down to tie a shoelace, and he got up, took a little pill out of his pocket, put it in his mouth, and then finished tying his shoelace. So I knew immediately what his problem was. I said, "How long have you had angina?" He said, "What do you mean angina?" Like he had cancer. I says, "After all, you just took a nitroglycerin tablet." He says, "I know." He says, I says, "Would you like to get rid of your problem and not have to take medication?" He says, "Marvelous, doctor." I said, "I'm not a doctor." He says, "Well, you're a PhD then." I said, "No. He says, "Well, what do you give me advice for? I got a doctor. I don't want to hear your advice." Well, that convinced me that people didn't really want to know what I was going to do. And my opinion wasn't that valued. But with enough persistence, I convinced enough people to get rid of their heart disease, their diabetes, their hypertension. By this time, enough physicians in Santa Barbara knew about me, but they invited me to give lectures about what I was doing and about my concepts of diet. And I began to lecture not only locally but nationally, in medical meetings and so on. And I got enough doctors interested to submit patients for a study. I used to finance and organize my own medical studies. For example, in '73, I had a study where I had 60 physicians in 22 states give me 2,000 patients for a whole year that I was able to put on the diet by mail. I prepared a 20 or 25-page sort of diet book for every patient. Plus, I wrote up a paper for each physician with all the references to tell them the rationale of the concept. And all the blood went to one laboratory, the bioscience laboratories in Van Nuys, California, so I wouldn't have any intra-laboratory errors. My wife and I analyzed the blood data and the other data of the patients and advised the physicians on what to do dietarily. And I did another study the next year or so with patients of the largest VA hospital in the world in Long Beach, California. I want to show the effect of diet on the control situation. We had a control group, 19 in our group, 19 in the control group. These were selected for claudication, that is not enough blood in the legs, for hypertension, for diabetes on insulin, for heart disease, stroke, we had everything. And what we showed at the end of 5 months was not only can we get people off insulin if they're adult onset diabetics, not only can we get rid of symptoms of heart disease, get people off hypertensive medication that they've been on for years, but also we were able to show by angiogram, x-rays of the arteries, reversal of artery closure for the first time in man in the iliac and femoral arteries. And I was invited to give that information at the International Congress of Rehabilitative Medicine on November 17th, 1975, which I showed my slides of the arteries. No one had ever done that before.
So you're getting pretty well known, but still that's a pretty big thing to do for somebody who's not a physician.
Well, it's still an avocation. It's sort of a hobby of mine.
Do they accuse you of malpractice or illegal practice?
No, I don't personally take care of that. I don't prescribe drugs. I'm not practicing medicine. I always work with physicians and hospitals.
So you were the educator?
I ran the programs, I set up the protocol, and I established the blood tests and all the other tests. But physicians told patients when to stop taking their drugs and so on. I didn't tell them personally.
So you got a lot of popularity, and then eventually you organized this into an institution.
Well, that happened because the results of my talk in Atlanta, Georgia, where this conference was selected by the conference, even though they had 100 other papers presented, as the most important paper. And they had me interviewed by the local science editor and went on the wire services around the world. And I got thousands of letters saying, where can I get this nutritional therapy for my heart disease, for my insulin problems, so on. And in 2 weeks, I made up my mind to start a center, a live-in clinic, to do the same thing as I did with this study.
This was self-supported? You came up with the finances?
Yes, right. I did it myself.
Lucky you were a good inventor, huh?
Well, actually, I theoretically retired in 1967. And I had sold all my interests and had a lot of value in stocks that I had taken for the companies I had and so on. And so I almost was doing this full-time since '67, but just for fun. And because of the tremendous national interest, on January 6, '76, I opened up our center, first center. And it was successful from the first hour.
You had patients, your reputation was that big at that time?
Yeah, well, we started with actually 9 patients and 7 spouses. And in the last 6 years, we've had 10,000 patients. We now get many physician referrals around the country. Even clinics like Cleveland Clinic, that's the home of bypass surgery, refers patients to us. Mayo Clinic refers patients to us, Scripps Clinic, Ochsner Clinic in New Orleans. We have a very solid reputation. In fact, some months ago, I was invited to give a nutritional seminar to 3 universities who got together in one stroke to hear me speak: Cornell Medical School, Sloan Kettering Cancer, and Rockefeller Institute. So that I have a certain amount of credibility now that I didn't have before. Essentially, the data we've got now for our 10,000 patients is that the degenerative diseases are an obsolete concept. They no longer are necessary in our modern civilization. I think if this dietary approach were followed, there'd be no such thing as people dying of heart disease, diabetes, and hypertension. In our studies, for example, of all the hypertensives on medication that come in, 85% are off the medication with normal blood pressure in 4 weeks. Even they've been on blood pressure medication for 20 continuous years. And people are not aware of the side effects of hypertensive medication. They can force you into diabetes. Occasionally, they can put you into kidney failure. You have to go on dialysis. Many times, they raise uric acid level and you get gouty arthritis. And for men, after a 2-year period, 50% of the men lose their sexual potency. Of course, Planned Parenthood, I think, is very happy about that. There are 75 million hypertensives in the States that the government says all should be taking drugs on a daily basis for the rest of their life. In fact, they've even gone so far as to say if you're 2 to 3 years old and your blood pressure is in the upper range of normal, not hypertensive yet, but in the upper range of normal, you should be put on medication if the side effects are minimal, so that, because you're probably one of the population when you get to be an adult will have hypertension, because in the upper range of normal at 2 years old. So you wonder who the drug pushers are. But that's not the real problem. The problem is that a study has been done of 22 million teenagers, and the blood pressure rise from 12 to 17 years old is so rapid, by the time they're 24, they're all going to be hypertensive. That's going to mean 100 million hypertensives in this country in 10 years. That means everyone will be hypertensive except you and me. And that's a tragedy. The tragedy is, here we have a dietary program that can get hypertension as a disease obsolete, wipe it right off the map in a month or two, so that all of these potential 100 million hypertensives would be completely normal without the debilitating effects of hypertensive medication, the fatigue it causes, plus all the other side effects. And incidentally, if there's no other way to treat hypertension except by medication, I would advocate hypertensive drugs too, because I don't want to see people have strokes. But there is another way that's free of side effects, free of risk factors. In fact, it's good for your other problems too, and gives you tremendous endurance and so on. And so that's the path that should be taken. I think the government is the biggest drug pusher in the business.
There's even a study that just came out that suggested giving blood pressure pills to people with high blood pressure may be detrimental to their health and their future life.
That's correct. That's the largest American Heart Association study ever done. The multiple risk factor intervention trial of 12,000 men. 6-year study, just completed last year, and the data just announced about 4 weeks ago is that if you're on diuretics and you had any sign of heart disease, you had a 50% higher death rate from heart disease than if you were not put on diuretics and your blood pressure just ran abnormal.
So it sounds like for some people we'd be better off just letting them have high blood pressure if we couldn't get them to change their diet, then to introduce the extra problem of pills.
Well, you have a choice there between, without the high blood pressure drug, you might have a stroke. So you have a choice of dying in excess deaths from heart disease or getting the stroke. I think the best choice is change your diet and you'll have neither. There's 11 million diabetics in the States, of which 10 million are adult onsets, or type 2s as we call them. Of the type 2s, we can practically get them all off their insulin, all their medications within 4 to 8 weeks. A recent study we just published in the American Diabetic Association journal Diabetes Care in the August issue gave our data on getting 75% of those adult onset diabetics on insulin we got them off insulin in 4 weeks. If they're on pills for diabetes, we got 95% of them off back to normal in 4 weeks. So diabetes as a disease is obsolete. As far as juvenile diabetes, we're publishing a paper now. We're able to reduce the dose of insulin by 40%.
It's important also for juvenile diabetics because of the complications. I imagine your diet would help that.
We save them from the complications of blindness, kidney failure, stroke, and heart attack.
How about your success with someone who has chest pain, angina, due to narrowed arteries?
We've been very, very successful there, not only with someone with angina from narrowed arteries, but people that bypass surgery and all the bypass is closed, and the angina comes back with a real vengeance. We've had people with 1 bypass operation, people with 2 bypass operations, people up to 4 bypass operations, if you can believe someone can go through 4 operations. We've only had 1 like that. All back to normal. Even with their closed grafts, they've now got enough circulation so they are off all medication and they lead a normal life.
If this diet is so effective, according to your findings, why do we find organizations like the Arthritis Foundation telling people that diet has nothing to do with arthritis? And also, why do we find other organizations not supporting dietary change to help people with their health problems?
I frankly can't tell you for sure. I don't like to think that that there's a vested interest or a conflict of interest involved, because I like to think basically all people are honest. And so I can't really tell you. It may be just that it's an entrenched addictive habit, and that is the hardest to change. On arthritis, we do have one group that's recently documented our data. That's Dr. Lucas at Wayne State University in Michigan, has now published documenting our diet as instant relief for rheumatoid and osteoarthritis, especially the fingers, hand, and wrists. About 90 or 95% of the cases, this disappears in 4 to 8 weeks. Even though the fingers are so gnarled and the joints are so distorted, it doesn't make a difference. The tenderness, the pain and the swelling disappears. And with arthritis of the knees and hips, we only have a 50% success rate, though. I think the other 50% we may get a little bit late.
Now, this is rheumatoid arthritis you're talking about?
Rheumatoid and osteo.
And osteo.
Gouty arthritis, we have 100% success in get rid of.
That's understandable.
Yeah.
Psoriasis is a disease that's been associated with a rich diet. Do you have any success with that disease?
Psoriasis, we've had almost 100% success. It takes up to 4 months to get rid of it, though, in our worst patient. We had a woman physician who had psoriasis for 25 years, over her face, all over her face like smallpox, plus in her hair and the rest of her too, but that's what showed. It was so bad that sometimes she wouldn't leave the house. It took 4 months to get rid of it, and it's been gone now for 4 years.
Are there any other diseases that stand out that you think are well treated by the type of diet you use?
Well, gallstones are reversible.
You can make them disappear, or just
We have
the
two
pain?
cases, no, where we've had reversal of dissolution of gallstones. Although that's been confirmed in animal studies. And you take cholesterol out of the diet, after all, the gallstones in developed populations are cholesterol gallstones. So they disappear.
If it would just relieve the pain, which I imagine it does in nearly every
Oh, it
case,
does,
that would
yes.
be enough
Right.
from gallstones. Bowel disorders, you have some luck with
Oh,
those?
yes. I would say that this is the best kind of dietary program for all colon problems. Diverticulosis, spastic colon, ileitis, Crohn's disease, spastic colon, ulcerative colitis, hemorrhoids, fantastic results. And this tragedy of all those diseases is that they treat them with a low-fiber diet, which causes the disease.
Constipation, I imagine you're pretty successful with, too.
Oh, yes, that disappears in a hurry.
100%,
Yeah.
sure. As a physician, there are some diseases that I would even be frightened to talk about, such as cancer and its relationship to diet, particularly in the area of treatment. Is there any relationship to diet and the prevention of cancer? And can you go a step further? Can you tell me whether you think there's any relationship between diet and the treatment of cancer?
I think we have to go to the National Cancer Institute's recommendation. It just come out about 3 months ago. They're the major cancer research group in the entire world. They get $1,000 million each year of our tax money to tell us what to do. And with that kind of payment, you ought to listen to. And 3 months ago, they came out with the recommendation and the finding that the principal cause of breast cancer, colon cancer, and prostate cancer is simply the amount of fat that you eat in a diet. No other factors. Just that one factor. And worse than that, if it's a polyunsaturated fat, it'll double your risk of colon cancer. And polyunsaturated fats are corn oil, safflower oil, sunflower seed oil, the oils that the American Heart Association tells you it's good for you to have. So the American Heart Association is going to have to change its recommendations now.
So it seems that organizations, or at least national institutes, have come along to the point where they're saying that cancer is not inevitable and that we can do something in our lifestyle, particularly our diet and smoking habits, to prevent it. How about the unfortunate people who develop cancer? Is there any reason for them to change what they're doing?
Well, there certainly is, because there's no risk for them to go on this kind of diet, because it'll give them maximum circulation and lower the risk factors for all the other problems that could happen to them. And there's a chance it could help them. There is a bit of information scattered around, isolated cases, that seem to show a very positive result on people with advanced cancer. Now, it's not factual or proven yet, but there's no risk for people to go on this kind of program, and there's a good risk that a good chance they can help their cancers.
It seems to make sense that the thing that caused a disease you ought to stop doing.
That's certainly true. And I even had one woman in 1970 get rid of the worst form of stomach cancer I've ever seen. It's called Rheumatoid plasticus. I don't know if you're familiar with that. Rheumatoid plasticus is when there's nothing you can do. If you have a tumor, you can always cut it out. But here, the cancer completely covers the inside lining of the stomach, up the esophagus, down the small intestine, and it so grows, it completely drowns out all the gastric juice producing cells. The stomach is dead. And the food pipe or esophagus is so closed down you can't eat solid food anymore. Nobody lives more than 6 months after diagnosis of that problem. The lady then with the planitis plasticus was operated on, and when they saw what she had, they just closed her up, gave her pain-killing pills, and told her she had 3 to 6 months. I got her 2 weeks after the operation, and it's hard to believe that she improved so fast. Within a month, she required no pain-killing pills. Within 6 weeks, I had her go back, and we put a tube down her to see what was going on in the stomach. And sure enough, there was some stomach acid. And then I knew we were going to have a chance. It took, however, about 6 months to 8 months before she could eat solid food. The way we would test her, she would eat a little solid food. If it went down, okay. If not, it would go right back up. But she was followed by me for 2 years until I lost her. But no symptoms anymore. She lived a completely natural life. And I think it had to be the diet. Although you can get a spontaneous remission with cancer, I doubt if it happened in this case.
So as far as you know, she didn't die from cancer?
Oh no, she never died from cancer, yeah.
Could you explain a little bit about the diet that you use for people, what it consists of?
Yes, a whole grain diet permits you to use a lot of pasta dishes, spaghetti, lasagna, pizza, made to our recipes, of course. The noodle dishes, brown rice, of course, and all the brown rice kinds of dishes you can make. And corn. Corn is a very popular way to handle things because you make tortillas, a lot of things that Mexico dishes that we have incorporated. And then the other grains, millet and so on, has been popular in Eastern countries. There are many, many entrees that we have, but they're very versatile because we take any foreign cuisine and translate them into our kind of menu.
Okay. So what I've heard you mention is starches, vegetables, and fruits. Is that the diet that supports health best?
Yes, I think so. Potatoes, of course, beans and peas are included in these. Yes, I think so. Dairy products are unnatural to man.
So dairy products are a little bit in your diet, but
they're in our diet, but we do that because we don't want to alienate the whole world.
It's just for the pleasure of the palate.
Yes. I don't even know if you can say that because the palate is trained, just like you're trained to smoke cigarettes. And people are not aware that dairy animals have just been domesticated in the last 5, 6, 7,000 years. Before that, no human being ever had dairy products after they're weaned in their whole lifetime. And that had been going on for hundreds of thousands of years. There's no human being ever had dairy products until just these last 5, 6, 7,000 years. And that's only in certain limited parts of the world. 70% of the world's population has never tasted and never will taste dairy products in their lifetime after they're weaned. Today.
And yet there's so much emphasis in our country about that 4 glasses of milk.
That's because the group making the recommendations is the National Dairy Council.
And they're interested in
Interested in destroying the American public. I think they work for Russia.
Do you are there any problems with the amount of dairy that you use? I understand you use low-fat dairy.
No fat.
No-fat dairy, skim milk,
right.
skim cheeses.
Yes,
Do you run into any problems by using that amount of dairy in your diet?
Well, 25% of all white adults in the Western world have lactose intolerance, 75% of the blacks. It's not natural for people to maintain the enzyme to digest dairy products after they're weaned. In fact, in places like Thailand, 95% of the children over 4 don't have lactase, the enzyme to digest milk products. It's unnatural for humans, but you can cultivate the enzyme to stay with us for a period over hundreds of years of doing it.
So what happens if someone who doesn't have this enzyme consumes skim milk or...
Then they're going to get cramps, diarrhea, terrible gas pains. They'd be much better off without it.
Do you ever notice other problems from dairy products such as food allergies from the milk?
Well, of course, yes, milk protein can be very allergic if the mother fed the child that before the child was 6 months old. Any food other than mother's milk, that a child has before it's 6 months old that probably will be allergic to. And it could be even the good things, like the grains or celery or whatever you want to feed them. A child's intestine below 6 months old simply is not adapted for other proteins than mother's milk.
How many people do you think have an allergy to milk that you see in your practice?
Everyone who has had it before they're 6 months old.
That would be most people in my generation.
Oh yes, in your generation, they're all through it. They're good health. I mean, they're all lost. They're all lost to allergy.
Your diet also includes a little bit of light-skinned chicken or skinned chicken with light meat, and also a small amount of low-fat fish, and I guess occasionally a little bit of well-trimmed beef.
Well, beef we prefer to have as grass-fed or range-fed. We do not advocate feedlot cattle. The best we'd permit would be, say, a piece of flank steak, a small piece, so if you ever do that. But feedlot cattle is usually very high in fat, at least 70% of its calories in fat.
Do you see any, do you run into any problems by feeding this small amount of flesh to people?
Not particularly.
Do you see any advantage to feeding that small amount of flesh to people?
Not particularly, except that it makes them feel that the diet is compatible with their previous lifestyle to some extent.
Do you ever worry about dragging people back into their old lifestyle by feeding them small amounts of the things that they were so attached to? For example, if you were dealing with a cigarette smoker, once you got him off cigarettes, it would be fatal to give him one cigarette once in a while. I wonder if someone who's changed their diet, if you give them a small amount of what they used to love so much, if it ever drags them back into even large amounts of that food.
Well, actually, what I find in experience is this. I find that people, for some reason, lose the taste for meat, for beef. Regardless of the size, they just lose the taste for it. And they stay with fish or fowl, and they learn to eat as a condiment. Once they get out of the idea that it's no longer a center plate, main feature, and it's just a condiment, they treat it that way. And then the use for large quantities is gone.
Is there any concern that a pregnant woman, a child, or an average American should have about these two nutritional factors?
Absolutely none. First of all, on calcium, the World Health Organization, that's part of the United Nations, was given the task of getting together cases of calcium deficiency so they can report at one of the conferences. They're very embarrassed when the conference came up, and here's what the report was. We're sorry to advise you, we can't find one case of calcium deficiency in the entire world's literature. That's the last thing we have to worry about is calcium deficiency.
Seems like a whole industry is based on advertising their product.
They certainly are. Why does the United States have the highest calcium requirement in the entire world, 800 milligrams a day minimum? Why is it that the World Health Organization only requires 400 milligrams of calcium a day? Why is it that a Bantu woman that has 9 children during her lifetime and breastfeeds 2 years at a time only needs 350 milligrams of calcium a day? It's because we have what we call the National Dairy Council in our country. That's why we have such a high requirement.
These Bantu women, as I remember, are very healthy. They have all their teeth and they have very strong bones.
Very strong bones, and more than that, the reason they retain all their calcium is because on a low-protein diet.
So protein has something to do with calcium?
Certainly has. If you take more than 16% of your calories in protein, you go into negative calcium balance. That is, you'll expel more calcium out through your urine than you'll take in by mouth, even if you drink 2 quarts of milk a day.
So the amount of protein in milk is so great that it wastes all the calcium that's in it? It just, you lose it out of your urine?
Yes, if you take that in addition to other animal products that increase your protein intake, all that calcium in milk, you waste it because it's all going to go out through your urine. And more, your bones also are going to melt and go out through your urine.
So possibly this is a cause of a disease called osteoporosis?
It's the principal cause of osteoporosis.
It sounds like the danger is getting too much protein.
That's the big problem. In fact, the worst cases of osteoporosis in the world are among the Eskimos. They're on the highest protein diet in the world.
How about too little protein? Does someone who decides to eat a vegetable diet, do they have to worry about getting enough protein?
It's impossible to have inadequate protein if you eat enough calories to maintain your weight. You couldn't design a diet low enough in protein to get yourself into protein deficiency. Even if you're a skilled dietitian, you'd have a real tough time.
Yet it seems that almost every time you speak or make a statement, there's a dietitian or some other expert who turns around and says that you can't get enough protein or possibly enough calcium in the diet or all the amino acids. Why does this type of information keep getting stated?
You find this hard to believe, but I'm faced with people saying vegetable proteins are an incomplete protein. And I say, what does it mean to be an incomplete protein? They say, well, it doesn't have all its amino acids. Yet every vegetable protein ever analyzed has every amino acid known to man. If a protein really wants to find one without its amino acids, I can point out two of you, and they're both animal proteins. Gelatin doesn't have all its amino acids. Albumin from egg white, the white of egg, doesn't have all its amino acids. They're still good proteins, but you can't criticize vegetable proteins because they have every amino acid.
Are they adequate in the amount? Some people say that they may be present, but there might not be enough for human nutrition.
That's absolutely false. Dr. Lee of Purdue did studies with 20-year-old young men, and she was able to show that even on 6% of the total calories using protein as white rice, plain white rice that I wouldn't recommend to anybody, no vitamins, no minerals, no dietary fiber, that was good enough to give them all their protein needs. These are 20-year-old healthy young men. The diet I'm recommending has 13% of its calories in protein, twice what you need. In fact, what you have to do is throw away half the calories and protein I give you. You can't use them. And you can't store extra protein.
There's a popular book now called Diet for a Small Planet, and it seems like most people interested in changing their diet are heading towards that book. Do you have any comments on the nutritional information in that book?
Yes, I have. It's unfortunately a misguided book. They talk about protein complementing your proteins. It's unscientific, it's very unsound, and it's misled a lot of people.
Do you think it's a good step in the right direction, or do you think it's going to set people back?
Well, it set people back because they think that there's something wrong with vegetable proteins, that you have to mix them and match them so carefully, or else you'll run into deficiencies. I think it did more harm than good, frankly.
The diet that you use is quite different than what Americans are used to, and it must be quite a shock for people when they first are presented with your type of diet. Do you find them initially accepting it, or do they have to think about it for a while before they change?
It depends on what their motivation is.
And in there you're talking about illness, how sick they are.
If they're sick people, we've had people who said that if they can get off insulin, get rid of their terrible chest pain, they'll eat cardboard and water.
And how long would it take them to get used to cardboard and water?
2 weeks.
About
That's
2
all.
weeks.
It's a very short period. In fact, it only takes 2 weeks to get accustomed to eating without salt.
And then do they prefer it or just tolerate it at that time?
No, they tolerate it then for about another month. And after that, they prefer it.
I see.
In fact, they think they're eating gourmet food in a couple months.
And then if they start to enjoy it, I imagine they'll stay on it.
There's no question about it. They've now trained their palate.
And how long have you looked at your patients to see how long and how many of them have been able to stay on this type of dietary program?
Well, we now have 5-year follow-up figures. And the 5-year follow-up figures show 80% will comply.
In your program, you also make some very strict recommendations, which would be obvious to most of us. And those recommendations include not using drugs such as caffeine, alcohol, or tobacco. Those type of recommendations, they're very important in getting people healthy.
Well, tobacco, of course, is a conscious form of committing suicide. Anyone who wants to use tobacco really shouldn't even worry about their diet. They should just jump off a bridge, save their family money. They should do something useful with their life. If you're going to continue smoking, you're hopeless anyway, and I wouldn't even waste time trying to improve yourself in other ways. The diet will help to some extent, but you're hurting yourself so much with smoking, from developing osteoporosis because of smoking, bladder cancer, lung cancer, tripling your incidence of getting heart disease, dulling your brain, hurting your hearing, ruining your vision, aging your skin. I don't know how people continue smoking. As far as alcohol, I have no serious objection of people without symptoms, without medication, having an alcoholic drink a day, if nothing else is wrong. Beer has some special problems. In men, it's been correlated with colon cancer. In women, it could be a problem for breast cancer. The facts aren't in yet. But alcohol is a drug. It's not a food. And if people want to drink drugs, I think it's all right. So that these factors, you really have to keep your eye on.
Okay, and caffeine also has an adverse effect on
Caffeine
people.
has many problems. It's certainly associated with fibrocystic breast disease in women. It's associated with ulcers in both men and women, and that means either decaf or coffee will create ulcers because it greatly increases the secretion of stomach acids, both decaf and coffee. It's got many problems, and it certainly shouldn't be used as a beverage.
How about people who have high blood pressure? Should they drink caffeine or alcohol?
They certainly shouldn't.
Do you notice an effect when they quit?
Well, there's no question. I mean, the scientific studies tell us that both caffeine and alcohol will increase blood pressure.
We've talked mostly about diet. Do you have some feelings about exercise?
Yes, I feel that walking is a very satisfactory exercise, and if you walk at a nice brisk pace, that is as well as you can do without discomfort, for an hour a day, or 2 half hours would be fine, or even 3 20-minute walks, and anyone could fit that into their schedule. That's all you ever have to do to be physically fit all your life.
How do you feel about endurance jogging?
Jogging is fine if you want to reach that extra level of endurance. Now, I jog for my exercise, but that's because I've been addicted to it these many years. And my wife runs with me. We might run a 5 or 10 mile run most days. But that's not necessary unless you want to reach that level of endurance.
There's been a recent study in Rhode Island that suggested you may increase your death rate from heart disease by about 7 times by jogging.
That's only if you're on the American diet.
If you eat right and you exercise heavily, you should do just fine.
You'll never have a problem because the ideal population, the Tarahumara Indians in northern Mexico, 60,000 of them, they run 200-mile races. They're on this diet that I advocate to the percent point. And they haven't found one case of heart disease since 1910 when they first started to look. Now, don't worry about heart disease with endurance running if you're on the proper diet.
Now, for people who are ill, you start them out on a very, very moderate exercise program?
Oh yes, walking is always prescribed. Very mild walking, we gradually build them up and so on. Running is something we actually don't encourage the patients because if a patient for some reason should get off his problem, get off his diet and go back to the old ways even for a short time, it could die from running. It's too great a threat for people that have had heart disease. You have to be very, very careful if you have had heart disease and you want to run. There are no deviations allowed. That is very rarely. You just must maintain yourself with a very strict diet if you want to run.
Someone who wants to bicycle or swim, would that be okay with you?
Oh yes, of course. Any of the activities are fine except weightlifting that you have to do in moderation if you have heart disease.
There are people who are very excited about aerobic exercise. Do you think the aerobic component of exercise is something people should pay attention to?
Yes, in fact, the aerobic component is the only thing they should pay attention to because you want to get your cardiovascular system developed, and you do that with aerobic exercise. And running, of course, is aerobic exercise. And walking is a very good form. People are not aware as they walk, and if they swing their arms naturally, each arm will swing 1,000 times per mile. It's a lot of calisthenics.
Some people like to play tennis, and they're criticized for playing tennis because it's not aerobic. Do you think that's a fair criticism?
I think so. I think that playing tennis is very good, providing you walk an hour a day.
I see. So there are some very specific types of exercise you'd rather have people do.
You have to do a continuous aerobic exercise, get your heart rate up to a certain minimum amount that has to be determined by a physician to keep up your cardiovascular fitness. Tennis is stop-and-going exercise. It doesn't build up cardiovascular fitness. You've got to have the fitness first before you really should play tennis to an extent.
I see. It might be a little bit better than doing nothing.
Tennis?
Tennis.
It depends. If you were going to stay in the American diet, I wouldn't play tennis because the very fast motion, the very fast rate of getting your heart rate up could kill you, just like jogging, if you're on the American diet.
Can you tell me about any plans you might have for the future?
I think it's time to demonstrate that this dietary program is not just for sick people. And because of that, I was at Kona, on a large island, on October 9th for the triathlon. That's the very substantial endurance contest. I think it's the world's greatest effort in the way of an endurance contest. Almost a 2.5-mile swim in the open ocean, a 112-mile bike ride, and then a 26-mile marathon, all together. They all run back to back, and the world's record is just a little over 9 hours. And I sponsored 6 athletes in the contest October 9th to demonstrate that there is no dietary program in the world that can give the kind of endurance that a high carbohydrate of natural foods diet can give. And of the 850 entrants, the number 1, 2, 3, and 4 place winners were among my 6 that I sponsored.
So this is a diet for healthy people.
To be healthier.
To be healthier. If you're making that type of recommendation, are we talking about children and pregnant women also?
We're talking about children right after they're weaned, and we're talking especially about pregnant women because it's the best dietary program for pregnant women. It'll get rid of the risks of toxemia, of the many symptoms that you can get along with pregnancy, with the threat of varicose veins, and will give them a much easier delivery because they'll have much better circulation.
It must be hard for people who have children and for women who are pregnant to follow that type of advice when so many other people are saying different things.
Unfortunately, the advice they get from the dietitians and from their physicians who are treating them during the pregnancy are not based upon sound nutritional experience. They're based upon arbitrary guidelines from set down, and unfortunately, they do damage to the pregnant woman.
You've also published a few books.
Yes, the books, the first book I published, I was a co-author back in 1972 or 3.
I noticed that there were a couple of MDs that preceded that book.
Well, they weren't MDs, they were PhDs.
PhDs.
You know. And they didn't have anything to do with the book, incidentally. In those days, I thought that if my name was first on the authorship, nobody would buy it because I had no credibility. So these 2 men were part of a small research foundation which was trying to raise funds, and I suggested that they put their names on the book first because one was a PhD, a mathematician, but nobody knew that. And I had my name last. At least it gave the book a chance to be published.
And then you have 2 subsequent books.
Yes, well, the 2 subsequent books have sold about 3 million copies now.
You have a lot of controversy surrounding you, and a lot of people would like to see you fail, I think.
There's no question about that.
You are sort of a lone person standing up there giving a different message for people to follow, and you have quite a following.
I'm not alone anymore. I think if I would disappear from the earth today, the movement would grow, and it's too late to stop it. There's no question. The world is changing every day. Just last month, the major canning companies announced no more salt in their canned vegetables, which is a tremendous shock because they didn't even market test it. But they're so confident it's going to work, they're changing the whole product line over to no salt. Now that's fantastic.
How do the industries feel about this type of change? We have the big dairy industry and the meat industry. Are they feeling the American public changing its preferences?
There's no question about it, and they're very worried about it. I read their newsletters they send out to their subscribers. In fact, a number of them mentioned me by name, that they better watch out for me because it's going to hurt their business.
Well, it sounds to me like nature designed our food pretty complete.
I think so.
And all we have to do is answer our desire for food or hunger, and we're going to get our nutritional needs.
I'd be careful about that because many people desire only to eat ice cream. I think you have to get rid of the artificial tastes that have been created by our artificial society and get back to natural ways. Once you get back to a natural diet, then you can sustain the diet that you should be having.
That's very interesting. So we have really nothing to worry about as for recommending that people eat a diet of starches, vegetables, and fruits is what we're talking about.
No problems at all.
And they should stay healthy and live to be how old?
7 times puberty, which is 105 to 120.
How did you get that information that a man should live that old?
All primates live 7 times puberty.
Very interesting.
Right.
Is there has anybody ever tried to validate that?
Well, it's in every species. You check out any species, and you get the sexual maturity and multiply by 7, and that's the lifespan of all the animals.
Very interesting.
Yeah.
So that's how old you're going to be. How old are you now?
I'm 67.
And you look like you're in tremendous health, and it sounds to me like if you hadn't figured this out, you wouldn't have made it past 40.
Well, I probably would have had an acute problem when I was 41 or 2. I think I would have been sort of a cardiac cripple, which I'm glad I'm not today. Heart disease is something I'm not going to have a problem with. I worry more about my long airplane rides.
Very good. Well, thank you very much.
Thank you.